The format we have today is, again, as you've seen, it's not about technical aspects of intervention, it's more about what's being done and how we can improve things. So I'm very honored today that we've got representatives of Neuroradiology Society of Pakistan and Neurology Association. Dr. Wasi and Dr. Umair Chaudhary are here. So I'm going to invite now Dr. Umair Chaudhary to give us the neuroradiology perspective of how what they are doing and how they feel things should be done in Pakistan. Welcome, sir.
Thank you, Asim. In fact, I was just thinking there, I'm already impressed by the presentations. I altogether changed my subject of my topic after listening to you people. And I always talk about the topics before, usually share with my colleagues and my youngsters. Ye sirf phairon ka kaam hai. I mean, they should be dedicated and they want to give something to the community, to the country. So, usme Asim is a big name. So, I'm so glad. I mean, मैं सिर्फ आपको just sharing the slide or few slides. In fact, ये कौन सा?
This next is the back.
अच्छा ठीक. Thank you. I just want to show this slide, which is coming. Most of the doctors have seen this brochure when come across with the stroke patient and others. In fact, we were doing neurointervention since many years, and we have done about 16,000 cases, but mainly of hemorrhagic stroke, which aneurysms, AVMs, and carotid stents, and all the endural AVFs, which is not related to the stroke, but partly you could say. And this is another important slide. In fact, in 2013 or 14, I was sitting with one of the guy who's here, Dr. Osama, sitting on the right side. We met there first time in Turkey in an international meeting of neurointervention, and he's basically a stroke neurologist. Then we just interacted. He said, why don't we form a Middle East Asia Congress, which developed later, Minasino, and now it is internationally recognized. So I was talking with him, and I was already hearing about the stroke. We should treat stroke, but unfortunately working in a public hospital, the funds are the big issue. And because we are not being supported by the army people and others, it's just a civil. And secondly, it's a more, no one was keen to do these things. Even in my department, when I told them we want to start stroke, some of my colleagues, they're playing golf, even myself, they said, sir, you will disturb over golf. It's very difficult to come in the evening or night and all this. So many hurdles I went in. So this was the first group which we had a workshop in 2015. The neurologist was there, neurosurgeon was there, the guys from Afghanistan, from the radiologists. So what we did, it's a very different sort of a workshop. We were doing the stroke cases in the morning, in the evening, and this consultant, the guy, we put him in a hotel next to our hospital. So he was coming in the Fajr time, and we did one case. So these sort of things we faced when we did the first case in 2015 with his help. And I'm just going, just passing these slides. These are not important because already discussed a lot about it. There are few slides again. When we did the first course stroke in 2015, there is the best part is even during those that workshop, the Mr. Clean study came up that was so encouraging for us. On the same day when we did the first case. So it gave us a big strength what we start doing at Lahore General Hospital. And unfortunately or unfortunately, so far we have done not much cases, not more than 200, but without TPA. We don't have access to TPA. And TPA is, you know it, officially just registered a few months back. So this came up, or of course this is everyone knows it. I don't want to discuss this simple. And during this period, I think realize And I'm a strong advocate, the cardiologist should come. This is back in 2015 I'm talking about. Before that, with my previous speaker, the term used horse. Yes, you people are the horse. So I was in Czech, and they were talking about the cardiologists. Most of the cardiologists were doing neurointervention, particularly with the stroke. So there is one sentence I always encourage my youngsters, कि stroke treatment, जो mechanical thrombectomy, is easier than neurointervention and easier than cardiac intervention. Believe me. और आपके पास जब patient आता, either he has to die, has to be crippled. So you are saving that patient at least 55 to 60%. So when we had this workshop, and after a few days, Asim came, stayed for a few days. मेरा ख्याल then he thought कि नहीं यार ये कुछ भी नहीं कर रहे. Then he left for America, and mashallah he did a wonderful job there. So this, we made the first protocol in 2015 for getting the patients. So this was a self-made program, but it worked for a few days, and believe me, I faced a bloody lot of issues convincing people from the ER to my colleagues to hospital. And I'll tell you, whatever we have done so far, it is nothing to do with the government funding. We couldn't get a government fund till then. And the aspiration penumbra, which is again came at that time, we got free of cost, and we did the aspiration technique and stent retriever, which I'm very thankful to the Medtronic, which is a big sport for us. And I'll tell you, I face a totally different issue. The Medtronic, Bolt, these people are not coming in Pakistan back in 2004-05. I convinced them. Well, they said, is it safe to come to Pakistan? I say, is it safe to go to New York after 8 o'clock in the downtown? So they, more or less, I convinced them, so they start coming to Pakistan. Now they are so established, and they are getting a lot of business from cardiologists or from other neurointerventionists. So this was the first case done during the workshop. You could see whatever we have done, it is a basal artery, which is my colleague was sharing. We can go up to 24 hours. This is Allah's blessing. We can treat these patients. The only issue which we face on those days, the post-care. No one is looking after those patients in a better way, but still we are able to do it. This was the first case done in Pakistan in 2015 with Osama and with my team. And here you could see, and luckily I was just thinking, we did everything which now the people are thinking. We put the stent, employed the stent in the MCA because they were collapsing again and again. So it is usually the people start doing it now. We had to do it at that time, and again with the Intrax and Medtronic, they gave us free of cost the stent at that time. After aspiration, again come back, and then we put the stent in. I just want to show, I mean, you could see the stent is there. We left it in that. So we got these complications in the very early days of 2015. So alhamdulillah, we have a sarphere log, so we didn't stop doing it. Here you could see after the putting the stent. So. And we have a Dyna CT, which is now old. Now Dr. Asim mentioned the new scans coming up, and they are giving a good quality. Even the DSA have a Dyna CT, but it's an old one with us, but we could see. This is an interesting case. Why I want to show this simple one case, and the first case which we did independently after the workshop, after 1 month or 2 months. So under general anesthesia. So far we did the under GA, very few cases we done under the local, because the concept is if GA reduces the blood pressure, whereas in stroke patient we need a blood pressure on the upper side. So this is after the treatment, and here you could see the MC is open. This slide is very important. The first patient ever, by done us in 2015. So ये 3 हफ्ते के बाद है. जब इसको करना था, इसको इस पूरी टीम ने घेरा इमरजेंसी से. तो उसकी फैमिली कहती है जी रात को इनकी बेटी की शादी है, तो कल ना आ जाइए. तो मैं बड़ा मतलब उनसे मतलब पैर ही पकड़ने रह गए थे, यार आज वो चीज़ें भी हमारी होंगी, पैसे भी हमारे होंगे, सारा कुछ होगा, थोड़ा प्यो बच जाएगा। उन्होंने प्यो तो ज़्यादा फिक्र शादी दी पई थी। अच्छा समहाउ हुई कन्विंस, और जब सबसे बड़ी बात जिस पे वो कन्विंस हुए कि थोड़े पैसे भी नहीं लगने, तो दे वर एक्साइटेड, ठीक है पैसे भी नहीं लगता, प्यो ही जाएगा ना, पैसे तो नहीं लगेंगे। सो देन वी हैड दिस केस, और बाद में ही बिकेम अ फ्रेंड ऑफ आवर यूनिट, एंड वो जितनी उसकी वसत थी, कनक लेके आ रहा है, कभी कुछ लेके आ रहा है। सो दिस वाज ओवर केस, एंड आई जस्ट वांट टू एम्फसाइज हाउ मच प्रॉब्लम्स यू फेस व्हेन यू स्टार्ट समथिंग न्यू। Mashallah, Asim has did a wonderful job, doing a wonderful job. ये one of the सिर फिर है जो अभी ज़ुबैर भी बात कर रहे थे, एंड आई एम सेकेंड इट। मेरा ख्याल है मैं आमतौर पे जूनियर्स को एक ही कहता हूँ, किसी से जेलस ना होना, लेकिन ये अच्छे एस्पेक्ट में मैं कह रहा हूँ कि आई एम प्राउड बट आई एम हैप्पी कि लोग हैं इस मुल्क में जो हु कैन डू फॉर द अदर्स। ये हमारा लेटेस्ट प्रोटोकॉल है विच वी आर डूइंग इट। ये मैं स्टॉकहोम में एक ट्रेनिंग पे गया था, तो देन वी फॉलोड अप दिस प्रोग्राम, बट समहाउ we are still a lot of issues in government sectors and getting not much patients in the public sector because of the financial issues. And ये हमारा एक जब हम coiling करते हैं which is
sorry, last 1 minute please.
अच्छा,
Thank you.
वास्ट एक्सपीरियंस इसमें हम ये coiling के दौरान भी थ्रोम्बेक्टमी करनी पड़ जाती है। ये acute stroke की young patients का था, एक बच्चा आया था, कार्डियोमायोपैथी, नो मैनी, ये द होल आर्टरी वाज क्लोज्ड, और इसके पास भी पैसे नहीं थे। तो ये हमारे इशू है। मैं आपको सिर्फ लास्ट जस्ट आसिम इफ़ यू गिव मी 30 सेकेंड्स, इनफैक्ट जो हमारा इस वक्त प्लान कर रहे हैं, वी आर मेकिंग 2-year फेलोशिप प्रोग्राम इन स्ट्रोक विद अमीना सीनो एंड विद UHS, एंड 1 year फॉर neurologist stroke program. I don't know, the next slide is closed. Could you make just one last slide? We have so far whatever we are, एक सिर्फ स्लाइड अगर आगे, वो चल नहीं रहे से। अच्छा एनीहो, उसमें था कि वो मेरा बड़ा इंटरेस्ट है कि जो कार्डियोलॉजिस्ट जिस तरह आसिम प्रोग्राम शुरू कर रहे हैं, इसमें वी कैन हेल्प देम अ लॉट, बिकॉज आई ऑलवेज से कार्डियोलॉजिस्ट हु आर इंटरेस्टेड, हु आर पार्टली कमिंग टू मी बिफोर गोइंग टू आसिम सेंटर, कि दे शुड नो न्यूरो एनाटॉमी और एम्ब्रोलॉजी। ये विच वी आर ऑलरेडी डूइंग इट, ये सेहत के प्रोग्राम के तहत हम कर रहे हैं। नेक्स्ट स्लाइड। और उसके अंदर ये था कि दे शुड स्पेंड फ्यू वीक्स विद इन ओवर डिपार्टमेंट की ओरिएंटेशन एम्ब्रोलॉजी की और जो है न्यूरो एंजियो एनाटॉमी की, इट शुड बी क्लियर। एसमेंट वगैरह स्कोर डेफिनेटली टेल यू व्हेन यू सी योर सेल्फ देयर फॉर 10-15 days, so it will be very good for the cardiologists to be in, and definitely they are the horse, they are the right, and we are maximum cardiologists who are doing diagnostic or intervention cardiology, they are the right person and we should support them. We have very few neurointerventionists, neuroradiologists, very few neurologists, but they are first trained army guy neuroradiologists working in a FIRI have done in more than over cases. They extended up to 400 or 500 cases now. So there is a great change now. Thank you very much for listening, and I just want to share what I feel the issue coming up. Thank you.
Thank you very much, sir.